Welcome to today's Health Spotlight, where we'll be discussing Rectocele, a condition affecting the rectum and its surrounding tissues. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's dive in and learn more about Rectocele. Rectocele occurs when the thin wall of tissue between the rectum and the vagina weakens. This weakening can happen for a number of reasons, but the most common culprit is childbirth. The strain and pressure of vaginal delivery, especially multiple deliveries or large babies, can stretch and weaken the pelvic floor muscles and connective tissues supporting the rectum. Other contributing factors include chronic constipation, straining during bowel movements, obesity, chronic coughing, and even genetics. These factors can all put added pressure on the pelvic floor, increasing the risk of developing a rectocele. Now, let's understand the process behind a rectocele. Imagine the rectum and vagina separated by a wall known as the rectovaginal septum. When the supporting tissues of this septum weaken, the rectum can bulge forward, pushing into the back wall of the vagina. This bulge is the rectocele. The size of the bulge can vary. In milder cases, the bulge might be small and cause no symptoms. But as the bulge becomes larger, it can interfere with bowel movements, causing difficulty emptying the rectum completely. This is because stool can get trapped in the pouch that's formed by the bulge, leading to discomfort and other issues. While accurate statistics can be difficult to obtain because many women may not seek medical attention for mild rectoceles, it's estimated that rectoceles are quite common, especially in women who have had multiple vaginal deliveries. The prevalence increases with age, as the pelvic floor muscles naturally weaken over time. It's important to remember that not all women with rectoceles experience symptoms, so the true number of cases may be even higher than reported. The symptoms of a rectocele can vary depending on its size and severity. Some women might not experience any symptoms at all, especially with small rectoceles. However, as the rectocele grows, symptoms may appear, including a feeling of pressure or fullness in the vagina or rectum. You might also experience difficulty emptying your bowels, needing to strain excessively, or manually pressing on the vagina or perineum to help with defecation. Some women also report feeling like something is bulging out of the vagina. Other symptoms can include fecal incontinence, painful intercourse, and lower back pain. Diagnosing a rectocele typically involves a physical examination by a doctor, often a gynecologist or colorectal surgeon. During the exam, the doctor will assess the pelvic floor muscles and check for any prolapse or bulging of the rectum into the vagina. The doctor might ask you to strain as if you're having a bowel movement to better visualize the rectocele. In some cases, additional tests like a defecography, which is a specialized X-ray taken during defecation, or an MRI might be ordered to evaluate the size and severity of the rectocele and to rule out other conditions. Rectoceles are often classified based on their size and how far they protrude into the vagina. A common classification system divides them into mild, moderate, and severe. Mild rectoceles are small and may not cause symptoms. Moderate rectoceles are larger and may cause some discomfort or difficulty with bowel movements. Severe rectoceles are the most pronounced, causing significant bulging and difficulty emptying the bowels. This classification helps guide treatment decisions. Treatment for rectocele depends on the severity of your symptoms. For mild cases with minimal or no symptoms, lifestyle changes like increasing fiber intake to prevent constipation, drinking plenty of fluids, and performing Kegel exercises to strengthen the pelvic floor muscles are often recommended. For more severe cases, or when lifestyle changes aren't enough, medical or surgical interventions may be necessary. A pessary, a supportive device inserted into the vagina, can provide support. Surgical repair involves reinforcing the rectovaginal septum to correct the bulge. This can be done vaginally or abdominally. The choice of surgical approach depends on several factors, including the size of the rectocele, the patient's overall health, and the surgeon's expertise. While it's not always possible to completely prevent a rectocele, there are steps you can take to reduce your risk. Maintaining a healthy weight, eating a high-fiber diet to prevent constipation, and avoiding straining during bowel movements are all important. Regular Kegel exercises to strengthen the pelvic floor muscles are also beneficial, especially after childbirth. If you're pregnant, discuss strategies for minimizing pelvic floor trauma during labor and delivery with your doctor. The prognosis for rectocele is generally good, especially with appropriate treatment. Many women experience significant improvement in their symptoms following lifestyle changes or surgical repair. Research continues to explore newer, less invasive surgical techniques and materials for rectocele repair to improve outcomes and reduce complications. For example, studies are evaluating the use of mesh materials in rectocele repair, although the use of mesh is a complex and evolving topic due to potential complications. Always discuss the risks and benefits of any treatment option with your doctor.